We're going to go over some abdominal radiology stuff. This is the last group, right? You said?
Yep.
Okay. So this, in the head and neck, you really only saw some x-rays and CTs. But in the abdomen, there's lots more you can do. So we're going to see a few different types of radiology here. So the first thing we're going to talk about is a KUB. It stands for kidney, ureter, bladder. It's an x-ray that runs from almost the level of the kidney to the level of the bladder. So again, on x-ray, you're not going to see organs unless they're filled with something. So for example, air. So this right here is an organ, filled with air. Does anyone know what it is?
The colon?
What part?
Ascending?
It's the ascending colon. The reason you know that is because you can see the haustra, the little pockets. You can see a little bit of the transverse, and then you can see this structure right here. What is it? Anyone know? What is it filled with?
Air.
Uh-huh. Say it if you guess.
Wouldn't it be the fundus of the stomach? Doesn't that have an air bubble in it too?
It does, but don't forget you're at the levels of the kidney and below, so.
But,
What are your organs that are like tubes?
well, the spleen.
Like,
The spleen is not filled with air.
Yeah, I
The
know.
spleen is filled with blood.
What is that noise? Stop, don't put me over here anymore.
Anyone know?
No.
Okay, that's the splenic flexure of the colon.
Oh.
Yep, it's pretty important, so make sure you know it. You can see a little bit of the descending, but not too well. There's not as much air there. That's pretty much it for organs. You can see bones, though. So you have your lumbar vertebrae. You can see the bodies. You can see the transverse processes. You can see the spinous processes. You can see the sacrum, a little bit of the coccyx. You can see parts of the pelvic bone. So, for example, this right here, does anyone know what that is?
Pubic symphysis.
What about these?
The
What parts of the
tubercle.
pubic bone? The tubercles are right here.
Those are
You can't really see them. Anyone know what those are? No, the ischium is the bottom part of the pelvis. Anyone know? No, these are the superior pubic rami.
Oh, I don't think we've gone over that.
And then you can't see the inferior ones, they're cut off. This here is what? Did you guys study the pelvis yet?
Not really.
This is the obturator foramen. You're probably not going to know the rest of these then, but this right here, anyone know what this is? It is not. This
The
is the head.
acetabulum?
Yeah, this is the acetabulum. This is the head of the femur, which you don't have to know because it's part of the lower extremity. But the acetabulum is on the pelvis.
So is that just the depression part?
Yeah,
Okay.
it's like the
It's like
cavity
where
where
it
the femur, the head of the femur fits. Yep. This right here is the wing, the ischial wing,
Where was
or
it?
iliac wing. Sorry, iliac wing. And what's this? What's this right here? ASIS. And this right here? Yep, the PSIS. I already said sacrum coccyx. What is this right here? And there's one right here.
The gonadal arteries?
Uterine tube?
Don't forget, this is an x-ray, so
Oh.
That's true.
it's the sacroiliac joint or the iliosacral joint. Call it either one. Any questions about the KUB? No. Okay. Next thing is IVP. It stands for intravenous pyelogram. And basically what happens is dye is injected so that you can view some organs. Mainly this structure right here, which is what? And you can see some parts of the kidney like this, which is what?
Calyces?
Same thing on the other side. Yep.
What
And
is
then
it?
The calyces. And you have this structure here and here.
The renal pelvis.
The renal pelvis, yep. And then what about this?
Ureters.
You have one on both sides, and then down here. Yes, so this is used to view the renal system. It used to be used to find kidney stones, but now they use CTs, so they don't really use this anymore. But you can see some stuff with anatomy, so that's why you're seeing it. Any questions about this? Okay. Next thing is a barium swallow. You really can only see one structure in a barium swallow, and it's this structure right here. Anyone know what it is?
The esophagus.
The patient drinks barium, and it lines the esophagus, and then when you take an X-ray, you're able to see it. So it's used to see things going on with the esophagus, and these are just two different views, so don't worry about that. But you can really only see the esophagus. Any questions about that? The barium continues into the abdomen, and then you have an upper GI series. So the esophagus over here is going to dump the barium into this structure right here, which is what? The stomach. The stomach is labeled, so it's not really too difficult, but this right here.
Fundus.
Body. The antrum, and pylorus. Yep. And then this.
Duodenum.
So yeah, so the barium just keeps continuing, and here's another view of the stomach, and here you can see the rugae really well.
What's the DB and the DS?
Duodenum, it's something duodenum, do you know? I don't know, don't worry about it.
Okay.
Your pictures on your test are not going to be labeled, so. Any other questions? Okay. Then after the GI upper series, you get the lower GI series. And if they just want to see the lower, they can do it through an enema, or they can just let the barium keep going. It takes longer, but sometimes they do it. So for example, here you have barium in the stomach, dumping into the duodenum up here, and then you have this structure right here, which is what?
Your small intestines.
Small intestines, yep. And then you have this right here.
Ascending colon.
And you can see a little bit of the transverse colon. Yep. This image is just the colon. So you have all the parts of the colon here. This is
Ascending. Transverse.
what is
Hepatic flexure.
Yep. Or right colic. Whatever you want to say. And this.
Transverse.
And what's this?
Spine flexure. Descending colon. Sigmoid. Rectum.
This right here, which is not on your test because it's pathology, but it's cool to see, is called an apple core lesion. So I don't know if you can all see, it looks like an apple core here. And this signifies colon cancer. So it's a classic sign of colon cancer. So don't worry about it for your test, but it's cool to see. Any questions about lower GI series? Okay. Next is an ERCP. ERCP is used to view the hepatobiliary system, all the different ducts. So use this picture to orientate yourself. You can see a lot of anatomy here. So does anyone know what this is?
The hepatic duct.
Which one?
The right hepatic duct.
This is the right hepatic. This
The
is
left hepatic. And then the common hepatic.
this is the common hepatic. What's this one?
Cystic.
Which makes this.
The gallbladder.
And what about this one?
The bile duct.
Common bile duct. Yep. And what about this one?
Pancreatic duct.
Which one?
The main.
Main pancreatic duct. Yep. What about this guy right here?